Hi everybody, so let's do another quickie. So we have asthma. We're looking at that as an obstructive disease. We also have chronic bronchitis. And then we have emphysema, right? So emphysema. How do we look at them differently? So we said that 1, 2, and 3 are considered obstructive. Chronic bronchitis and emphysema are considered chronic obstructive pulmonary diseases. And so these three, if this was common, chronic, or I was experiencing an asthma attack acutely, then all three of them would have trouble breathing out, right? Their FEV1 would be a lower ratio than normal. So instead of like 80% or 0.8, it would be much lower for FEV1. So I have asthma, chronic bronchitis, and emphysema. Asthma, primarily you think, because we're trying to separate the three, right? You think inflammatory process, right? So inflammation. And what are the 4 signs of inflammation? We have heat, redness, pain, and swelling. So herpes. So we have H, R, P, and S. And what are some of the inflammatory mediators associated? Whenever you hear asthma, you think hypersensitivity reaction, eosinophils, right? Eosinophils are associated with allergies and parasites, so allergic reaction, asthma. You also think IgE, right? IgE will bind to mast cells and basophils, so I'm just going to write mast cells and basophils, and they will secrete products like histamine. You'll also hear terms like bradykinin, you'll hear leukotrienes, prostaglandins. All of those are what we call inflammatory mediators. But let's take a look at how histamine affects inflammation and also contributes to the problems associated with asthma. So histamine increases what we call, it causes vasodilation, right? Vasodilation increases the flow of blood to the area. It also increases permeability. What does that mean? Permeability means if I was in a classroom and the doors were closed, then there will be zero permeability. But let's say that I'm in the classroom and I open all of the doors. That means permeability will be increased and all the doors are open. So now we can flow into or out of the room. The point of permeability or increasing permeability is so that the white blood cells can move into the area and fight infection. But in the case of asthma, this histamine release, vasodilation, and increased permeability causes fluid to move into the tissues. That leads to the swelling in the area, right? Also known as edema. Because I have vasodilation, it increases heat and redness to the area. And it becomes a problem when the inflammation, I guess, causes obstruction for airway movement into and out of the alveoli for gas exchange. Because if I don't have oxygen or fresh oxygen moving into the cells or into the alveoli, then nothing's going to cross over into the body and you're going to have difficulty with breathing. What do we look at when we're thinking chronic bronchitis? Well, you always remember the image is always a blue bloater. And there's some videos on the internet that you guys can watch, but just remember blue bloater. Chronic bronchitis a lot of times is associated with airway infection, right? So you catch a cold, maybe you're a smoker previously, so your cilia are paralyzed and they're not working. So I can't move mucus up and out of the airways. And chronic bronchitis, because infection, I always remember infection, blue bloater is the result of this huge amount of mucus production by goblet cells. The mucus becomes thick and viscous, and because my cilia are not working right, I can't move them up and out. So you have this huge amount of mucus that you're trying to cough out. You can't get it out. There's infection, right? You always get infection, not always. By definition, according to the textbook, chronic bronchitis, it occurs 3 months out of a year, and you have to have it for 2 years consecutive. So I said chronic bronchitis was excess mucus production, whereas asthma was associated with airway inflammation, hyperreactivity, right?